Thank you for being here today. This is a good topic, especially for healthcare workers. I know there's a lot going on in healthcare, and this is just one of the things that you're very busy with the cancer patients and everything that I just wanted to offer a little insight. And I hope today that you walk away with something new, maybe something that you haven't thought about before, or just even a little something that you can offer your patients. So I'm going to just dive right in. So who am I? I'm Stephanie Miller. I am a wife. I'm a mom. I'm a Mimi to two boys, two grandsons. I am a cancer survivor. My husband is also a cancer survivor. I worked in healthcare for 27 years. Those 27 years were in radiology, and most of that was in the CT department performing CAT scans. And I was also the manager for my department for most of my career as well. I am a cancer coach. I have a certification through the Cancer Journey Institute, and I also am a Reiki practitioner. I've been using Reiki in my practice for quite some time, and it's been life-changing for myself and other people. I am also a certified essential oil specialist. I have found that essential oils really got me through my journey, and so I use them in my practice as well. I have a certification as an end-of-life doula, and I also received the Red Letter Grant Award back in fall of 2022. And that, if you're not familiar with that, that is a grant for small businesses who it's a startup grant. So I was awarded that as well. So my story, if you don't know my story, it started 17 years ago when I was diagnosed with colon cancer. And my treatment was surgery. And so I had surgery, and then I just continued on with life and with work and all of the things. My husband had tongue cancer 7 years ago. And so I found myself in this new place. I found myself as his caregiver. And I thought I knew a lot about what we would go through again with his diagnosis, but it was much different than mine, which I've learned that everybody's journey is different. His treatment was chemo and radiation, and a much more extensive treatment than mine. So I found myself as his caregiver, and I also worked in healthcare. So I worked closely with oncology in the CT department. We did a lot of procedures, we did a lot of treatment and that kind of thing. And so I thought I had kind of this knowing of what to expect. And it was not what I expected. And it really took me, honestly, it took me years to heal from that. Lots of therapy, all the emotional ups and downs. Like everybody that has a cancer diagnosis, your mind takes over. You're afraid, you're fearful, and the future worries is probably the big one that I really had to work through. And I share that because I feel strongly that our experiences in life are lessons, and we can use those lessons as tools, or we can use them as a weapon against us. And I see that a lot in life with many things, but especially with our experiences. And so what I did was I chose to use my experiences as a tool and to help me kind of propel forward to today where I am supporting others going through the journey, because um, it's a hard thing to get through if you don't have support, and I don't want other people to suffer as long as I did. It was 17 years, and I'm finally to the point where I can talk about my experience and my husband experience without getting really emotional. So I'm using that life lessons as a good thing. My mission in my business and today is to help support and guide others and be an advocate for anybody going through cancer. It is a difficult, challenging time, and there's a lot of things that we don't know. And so when you go through it, you learn things. And so I want to share that with other people. I want to empower women. I want to empower anybody, and I want to help others heal and maybe heal faster and get through the diagnosis, the journey thriving instead of living in survival mode like we did for most of the time. And I just want to be this lighthouse for those who are lost. I know a lot of times people don't even know what they don't know. And when they see and experience some of the support that I offer, they are really incredibly grateful. Um, Lots of hidden truths come with a cancer diagnosis. Your world changes in an instant. That is one thing that I don't think people understand. You feel like you've totally lost control. You've lost control of your life. You lost control of your schedule. You've lost control of most everything. You just signed up for a ticket to the biggest roller coaster ride of your life of emotions. Not anything that is fun, but it's a reality. And life takes on different meanings, different perspectives. You see things differently. Your priorities change a little bit. Um, and you come out of the other side a different version of yourself. And sometimes that's not always something that people want. And the challenges that come along with it also is cancer's scary. There's lots of unknowns, lots of changes. Again, you feel like you've lost control of your life. The emotional challenges, there's emotions that you don't even know what they are, and they will show up one day and you'll be fine the next day. Again, this roller coaster ride of emotions is real. There's this urgency, pressure to make life-changing decisions. I've heard that before, and I felt that myself. Family, friends, our medical team, they're all really supportive, but they really don't fully understand. They don't have that deep relatability like someone who's been through it does. And the medical system uncertainties, especially in our times right now in our community, it's really scary for people. And what we yearn most for is normalcy. We just want life to go back to normal. And again, we come out the other side a different version. Normal looks different. And so this is what I'm going to focus on mostly today is this cancer journey roadmap. This is a roadmap that I was introduced to when I went through my coaching training. And when I saw this after, years after my journey, I was like, wow, why don't we know about this? Where was this when I was going through it? This would have been helpful. Like any life experience, there's phases that we go through. This journey is not a linear journey. The roadmap is ups and downs all over the place. And there's these three main phases and then all of these stages within. So we're going to dive in a little bit more to the innocent stage. So this stage is basically your life is kind of normal. You might feel like there's something going on and you go get it checked out, but you really are unaware that, cancer could be part of your life. And then you get the call. I think everybody that has had a diagnosis remembers the day that they got the call. I remember vividly myself. I was in the control room with my employees and I got the call and I knew exactly what he was talking about when he said metastases, when he said carcinoma, and your life changes in an instant. And I got that call and then I had to go back to my job and carry out the rest of the day. And sometimes your mind goes into overdrive. Sometimes the mind shuts down and that instant worry of, am I going to die? How many times have I heard that? And we've all know that. It's just like, that's the biggest fear. Am I going to die? So what patients need during this time is time to think, space to think, to digest the news, space to breathe, explanations in a way that we can understand. Sometimes these people have never heard of any of these medical words. And so explanations in a way that we can understand them is so much more helpful. And what happens is because our needs aren't getting met, we can get frustrated and we can get irritated. It is a change that we're not used to, and everybody processes it differently. Some go into autopilot and some shut down. And then you have the initiation phase, and this is when all of these appointments and tests and maybe retesting and these medical terms, treatment plans, a lot of the things that we don't know overwhelm the treatment maybe is starting. And right now, during this time, it's all new information to us. lots of challenges, lots of unknown, the fear of what am I going to have side effects? Am I going to be sick? Am I going to be like, the person that's on TV? That all of the things go through our mind. And I remember my initiation. It was my husband's journey, and we were sitting with an oncologist, and he was going through the treatment plan, which was chemo and radiation for my husband. And he said to us, "This is going to be hell on earth." And I didn't think about it at the time. I thought, wow, that's pretty bad. But this is a time where you're very vulnerable to what people say and you hear things, and that is all I heard. And that's all my husband heard. And so you go through this with that kind of a thing. And what we really need during this time is time to make informed decisions. We need time to just like, again, reassure us, support us, give us the information in a way that we can understand it. Hell on earth sounds pretty bad. But these are things that as a patient going through this journey, we remember things, support and understanding. And another thing too that I want to talk about is reminders, because everything's so overwhelming, we forget a lot. I still have folders of information from my husband's diagnosis that we never opened up because there was so much coming at us that there's things that we didn't even know about. After the fact, I thought, oh my gosh, it would have been nice to have this. And here it was in some of this information. So going through this information and reminding us. And so then we end up going into the treatment phase, which is the next part. And if you look at this diagram here, that treatment phase is the pit, and it's kind of got the swirly and it's deep down, right? And that's exactly what it is. I probably don't even have to tell you more about the pit. You can probably imagine what the pit is. It's the low point of the journey. It has this spiraling quality. Things are very overwhelming, confusing. You feel like it's like never ending. You're attempting to deal with the challenges that you're faced with in the way that in your usual way, but it might not be working. You feel sometimes like you're taking one step forward, two steps back. You don't feel like yourself, especially if you're in treatment, the side effects, the physical changes, and again, these emotional ups and downs that you just have no control over. Some people at this point really want to give up. So what we really need during this time is to be heard, to acknowledge what we feel, because what we feel is real. Those emotions are real. Encouragement, and again, reminders of things, because chemo brain is a real thing. Um, and just really to feel empowered and to just encouragement that we've made it this far. It's going to get better. Kind of that encouragement that we need. And then you go into this next stage of the treatment phase, which is these allies. And allies can be all kinds of things. They're people, places, objects, pets, information, music. I remember the allies for me was my aromatherapy. I started to use essential oils as just calming to my mind. And it was incredible how that was an ally that I looked forward to, that I would use all the time. But the allies are all around us all the time. But as a patient, we might not be willing to see them, especially if we're in the pit. But the allies can really help us kind of get up that hill, up that upper part of that roadmap. And we can, when we get to that point, we might be willing to surrender and kind of open up our mind to different things, new possibilities, maybe start to do things differently, maybe start to think differently, make some changes. But again, these allies really can help us get up there, get through it. What we need during this time, again, more encouragement. Celebrate what we've gone through so far. Celebrate those accomplishments, even if it's small things. Um, we need space to express emotions, and again, just help guide us through that treatment phase in any way that you can think, and empower us again, because again, we feel like we've lost control, especially when you start to not feel good. And then we go back to this roadmap, and I want to just explain something at this point. That pit and the allies, if you notice, you're kind of going up a hill, but I also want to just let people know that we can fall back. We can sometimes be in two places at one time on this roadmap. It's not like when you get done with the initiation, you go right into the pit, and then you're done with the pit, you go into the allies. We can fall back into these other areas. And so again, it's just this kind of ups and downs, but we eventually can get there. It just takes a little bit longer sometimes for others, and it might take a little bit more encouragement. And then this next phase is this re-entry phase. And if you noticed, I'm going to go back, this re-entry phase, there's this circular area where it says vision. And this is where the patient can maybe start to see like the light at the end of the tunnel and maybe see things a little differently. And this breakthrough can be a really empowering phase because it allows us to um, see things. Maybe it's like the light at the end of the tunnel, and we can actually sometimes reflect back on how far we came, how far we went, and where we're at now. And we can actually get this new level of awareness of ourselves, like, oh my gosh, I did this. And we can feel like we're making a little bit more headway. New territory is ahead of us. It's kind of exciting, but then on the other hand, it can be a little scary as well because it's unknowns. Again, we need a lot of assurance, reassurance. Celebrate again those little small efforts that we went through, the reminders and the evidence of how far we've come can really help that get up that hill. Encouragement is so big throughout the entire journey. And this re-entry phrase it can be very powerful if we let ourselves. And again, back to when I said we can use these experiences as weapons or tools. So encouraging, more encouragement than anything so that we don't use this as a weapon, so we don't continue on. And then we get to this transformation phase. And this is the point where the patient might start to feel like they're maybe a little bit more by like themselves. They can really feel a change within them, maybe in their mind, body, spirit, maybe things are starting to kind of make sense and kind of get behind us, experiencing and achieving what they wanted at the beginning of this for it to be over. Um, and so they start to see that. And we can also start to acknowledge what we've gone through, and again, discover what's new and be okay with that new. There's a lot of changes that we've gone through. And so this transformation phase can really encourage that. It's really all about embracing who we've become. And as healthcare workers, I think we sometimes get caught in just the the tasks, and we might not help help patients experience like that transformation and those changes and those positive things that they've gone through. So transformation is really a positive part of the journey, but it needs to be acknowledged by the patient as well. Sometimes it's hard. We need to reflect back on what we did and celebrate. Those, I can't say it probably enough, is to really celebrate the small things, the little accomplishments. Everything is a win when we are going through this journey. And this transformation phase can really take on a transformation, in its own time. Everybody is on their own unique journey. The transformation can take weeks, it can take months, it can take years. For me, it took years. I wasn't willing to see a lot of the changes as positive things in my life, but it took me years to figure that out. And that's why I'm here today. I don't want people to go through the years of trying to figure out all of this. When you've got a guide to help you through this journey, it goes much easier, much smoother, and we can actually thrive through this instead of just be in that survival mode. Um, a few things to note is everybody that's touched by cancer goes through this, not just the patient, the family members. I remember reflecting back on this as the caregiver for my husband during his treatment. wow, I know I can vividly feel and see and remember all of these stages. Um, and it was different than where my husband was at. So as a caregiver, you might be in a different place than your loved one. As a family member, you might be in a different place as your loved one who's going through it. And so everybody goes through this at their own pace, at their own journey and time frame. And then when we get to this transformation phase, it's not over. Even though the end of treatment is done, a new journey begins. Truly, that's what happens. Most of us think, okay, the end of treatment. I thought this. It's like, oh my gosh, I'm done. Yay. I mean, let's celebrate. Let's get on with life. And then honestly, you can start this whole journey all over again, especially if you deal with any kind of physical um, disabilities from treatment. If you're going into the workforce, or if a new situation comes up in the family, you start all over again because you have to process things differently now because you're a different person. So the end of treatment is incredible. Um, but it also brings on a new set of fears and anxiety. It can take months um, for us to realize and feel safe again because we've been with the care team for months. And then all of a sudden, abruptly, we lose that security of the check-in every week, of the appointments, of all of that, of the care team. You, as healthcare workers, play a big role in this journey on this roadmap. And when we are set free, it can be scary. So again, lots of reassurance, encouragement, and empowering that we've gone through already what we've gone through, and we can do this, even though we don't have that weekly check-in or that daily check-in sometimes. So the end of treatment doesn't necessarily mean we're done. Our new journey begins. So I wanted to just share some of what my clients say. Um, I ask them all the time, what are some things that you want your medical team to know? I mean, the medical team, if they haven't gone through this, they don't know what we go through. And so they shared some things. Um, one of them was, like my team was really good at reading me. The more they told me, the more overwhelmed I got. And she was very grateful that they could sense when she was overwhelmed. And so they would stop and they would take step by step. So it was really hard for her to make a decision because there was so much overwhelm, so much coming at her. Another one, it's like they didn't tell me what was coming next. The most she would hear a lot. We'll talk about that later. And there I can understand that working in the health system myself. Sometimes the plan changes, but everybody's a little different. Some people want it all up front, even though it's going to change, and some people don't. Too much urgency. This one made my heart kind of fall. She felt rushed into a mastectomy. That's a big life-changing experience. And she felt she was kind of pushed into that. She was rushed into it. Again, when we need time to process things. We need time to make those decisions. Um, One said, when I open up about how I'm feeling, um, the first thing they said is, well, we can set you up with a psych consult. And she's like, I don't want to see psych. I don't want more meds. Honestly, what we really want is just for people to listen. We just want people to hear us, help us process this and listen. That's one of the biggest things is um, we don't listen to hear, we listen because it's just part of what we do, right? We listen to we need to listen to understand. Emotional support should be high priority. Another thing is what would they want more emotional support from the MD? Sometimes they're too serious. And after treatment ends, you're kind of on your own. So these are just some thoughts that my clients shared with me. So we're nearing the end here of the 30 minutes. So what can you do? What I want is my dream is for you to share the cancer journey roadmap with patients, with family. Continue to provide the amazing care to this vulnerable population. It's not an easy task to be in healthcare with this cancer population. Share the cancer coaching services that I offer with patients and family. Share my cancer coaching services with providers, and really encourage your patients to find a support network. And I have a in-person community support to work for women. It's a women's cancer support group. We meet the first and third Mondays of every month from 5 to 6 in person on Brackett Avenue. So please share that, as well as share just about me, about my services. We are healthcare is treating the disease, killing the disease, but there's much more to cancer than killing the disease. Our whole body is affected. And so tomorrow, in the second part of this, we are going to kind of dive in a little bit more, and we're going to talk more about thriving through cancer instead of just being in that survival mode. It's all about a whole body experience. It's mind, body, spirit. And so I'm going to dive into that a little bit more just to offer a little more insight to what you can do for your patients. So thank you for being here today. I put that Cancer Journey Roadmap in the chat. If you want to grab it from there, you can to share. I got permission from the Cancer Journey Institute to share that. So that is yours. I will also put it in an email with the recording of this Lunch and Learn, and I will see you again tomorrow. If anybody has any questions, there are a couple more minutes. You can put them in the chat, or you can unmute and you can ask any questions.